Alrighty. So welcome everybody. I'm Dr. Brian Walsh, for those of you that haven't met me before. I am a chiropractor. Also, we do a lot of nutrition therapy in our office using vitamins, herbs, homeopathy. And because it's really working on the whole person, right? It's not just one problem. Many things come together to cause a problem. And we're going to talk about, for the thyroid tonight, the different factors that combine where people start having thyroid problems. Basically, it's not just one factor; it's a lot of them, really. Over time, that kind of build up. But I was an engineer before I was a chiropractor. I was an engineer for almost 10 years, electrical, and a chiropractor helped me out with my back, and I got kind of excited, like the whole lifestyle, and so I jumped ship and went back to school, and now this is 21 years in chiropractic. So I tell people I'm a bioengineer instead of an electrical engineer because I get to help people, which are actually more challenging than circuit boards, actually, because they have a lot more issues. So I like to start off with this quote because it embodies kind of how I look at things. It says, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." Right? That was Thomas Edison, like 100 years ago or so. And so he saw the importance of the human frame because the spine covers your nerves and protects everything, and it's real important. The diet, which should be the foundation of our nutrition, right? That's where we're supposed to get all of our food. And then the cause and prevention, because modern medicine is very good at surgery and life-saving and those type of things. But the focus is still not on cause, right? They diagnosed you with a problem and they give you a drug or give you a surgery that's going to take care of that. But there's still really not enough emphasis on why did it happen in the first place. So that's what we try to focus more on, is the why part. And then ultimately you want to prevent things, right? Because if you can start your children out raising them on whole food and good diet and exercise and teach them how to live naturally, they won't end up with a lot of stuff that people can end up with 50, 60, 70 years old. So it's really the prevention part that I like a lot, that we still don't do enough of in the U.S. So here's just a couple of statistics. When they take polls and these surveys and everything, they estimate roughly 12% of the population has thyroid problems. And a lot of doctors believe that's really underestimated, that they really, really believe it's closer to like 20%. Because what happens is some of these cases of thyroid problems, they don't go diagnosed properly because they can mimic other problems when you have a thyroid problem. Because the thyroid metabolism affects every part of your body, it can look like different things, right? And some people, they'll get the blood test for the thyroid and it's normal. But they'll have 8 of the symptoms that a hypothyroid person has. But their blood values are okay, so the doctor will not do anything. And so that leads people usually on a very long merry-go-round that could take years for them to actually get a good diagnosis of what's going on with their body. And we'll talk about ways to shortcut that so you don't go around the merry-go-round. There's really, you could think of things in 2 broad categories when it comes to the problems. Hypothyroidism with an O is the most common typically. That's where people tend to gain weight. They don't have to, but that's where they tend to, their metabolism slows down, easier to gain weight. Cold hands and feet are very common when this happens. Loss of hair is a common thing, dry skin. Usually it's more constipation as opposed to diarrhea. That's more hyper. Women will also have a lot of menstrual problems. So sometimes these younger women in their 20s and 30s that have menstrual problems, they'll just look at hormones for the female side and they won't look at the thyroid, because the thyroid can really affect how a woman's menstrual cycle functions normally or not. So that can be a clue too. And then a lot of people notice brain fog issues when their thyroid's not working very good, and also a hard time conceiving for women. It disrupts that whole hormonal pattern. So many different areas in many different ways, and you tend to be a little more moody too, more towards the depressed side is very common. The hyperthyroidism, that's more rare. That in my experience, what I've seen, that's usually triggered by like a viral condition or something like that, that attacks the thyroid gland and it puts it into this really hyper state. And people usually go there very fast. They usually start losing weight dramatically, like 10 to 15 pounds in less than a month. Their heart rate tends to start going higher and higher, and sometimes they'll go to the hospital because their heart rate starts getting 150 or more. And it's because the thyroid has gone out of control and it's really pumping up the heart rate. Very nervous, very sweaty, and these symptoms usually come on very quickly. And if you catch it, I've had at least 3 or 4 of those where they came to me before they went to medical doctor, when it was like the heart rate was going up and stuff. And almost, I think all of them were viral things that had attacked their thyroid. And when we handled the virus and got their immune system stronger, all their symptoms went away. So if they can't control it with medication, then they have to take it out, which is the only remedy they have for hyperthyroidism, because it can be dangerous because your heart can just totally go out of control. But they usually try medication first, and if that calms it down, then you're okay. And sometimes that'll fix it long enough for your body to take care of the virus, right, naturally. But sometimes not, and they'll have to have it removed or radiated, which is what you want to avoid, potentially. And then some people, you'll see them with the goiters, right? It starts getting very swollen in the bottom part of the neck. And sometimes they won't have any symptoms when they have the goiter, but it's a real indication that there's nutrients that are missing in the body that we'll talk about, because what the thyroid starts doing is it starts getting bigger, enlarging, and that's why you see the goiter. If you've ever lived up north, like Michigan, that area, they used to call it the goiter belt, because their soil is very depleted in like iodine and selenium and these different minerals that your thyroid needs to work. And these people were getting goiter a lot. And you supplement them with iodine a lot of times in the early stages and it goes away. So that's on if you get it early, you can help it a lot. And then there's another class that's kind of combines the two of them, where you may have heard of autoimmune thyroiditis, or the most common they call is Hashimoto's, which tends to be the hypothyroid. And that's actually the body attacking the thyroid tissue, and it starts either producing too much or not enough of the hormone. It's usually not enough. But the thing that's tricky with that one is that in the beginning stages, all your thyroid hormones can be normal. And so you go to you're not feeling right. You go to the doctor, I've got my hair's coming out, I'm gaining weight, all these different things. And they do the thyroid panel and it's normal. Well, there's nothing wrong with your thyroid. But what can happen, especially in the early stages of autoimmune problems, is the thyroid antibodies will be high, but the hormones will be normal. And that can go on for years, actually, before it becomes really bad. And so I've had several people that come to me and they've had these symptoms. And I said, did they check your thyroid antibodies? No, what's that? So I send them back to the doctor and tell them to check the thyroid antibodies and they're positive, which means they have this autoimmune condition in their thyroid. And sometimes if you get it early like that, where it hasn't affected the hormones yet, you can turn it around pretty well, because it hasn't destroyed the thyroid enough to where the hormones start shutting down. So, but again, that can hide because in the early stages it looks okay. Your blood work looks okay. But you can get that early and really fix it. There are medications sometimes, depending on the person, if they're really in bad shape, they may need medication in the beginning, especially for the hypo. Things like Thyroid, or they have Armour thyroid, which is more natural. I prefer that. But the goal is to find out why they're having the problem in the first place, which we'll talk about, and then wean them off the medication. We've been successful in doing that on lots of people, and once you fix the problem, and then you can wean them off and their body starts working normally again. But the longer someone's been on medication, the harder it is to get them off the medication. This is what I found. But sometimes you can lower the dose so they don't need as much of it. And they feel better. Because what happens, unfortunately, with some of these folks is okay, your thyroid has a problem, we'll put you on the thyroid hormones, and then they don't feel better. Their blood work looks better, but they don't feel real great. And so the doctors are like, well, I've given you the right medication, I can't do anything else. And so what happens in some folks, there's two of the hormones, T4 and T3, so that your thyroid produces. The T4 gets converted to T3 to be the active. In some people, they don't convert T4 to T3 very well. So if the doctor gives you T4 and you're not converting that very well, which your body needs the T3 a lot of, your blood work will look better, but you'll still not feel great. So that's where the Armour Thyroid, which has both T3 and T4, or they'll do two different medications where they give them T4 and T3 together that way. Those people usually do much better when they do that. But again, I'm trying to find out why things are happening wrong in the first place. But that's why sometimes people will get on the medication and their blood gets better, but they don't feel a whole lot better, which is frustrating. But it goes to these different things. If there's different organ dysfunctions, sometimes if people have adrenal gland problems, which sit on top of your kidneys, and they've been under a lot of stress for a long time, then when the thyroid and adrenal glands aren't working well together, it puts more stress on the thyroid gland. So they'll have more trouble that way. So sometimes fixing the adrenal glands helps. Sometimes people with pancreas or diabetes problems will have more likely to have thyroid problems. So sometimes it's other things. Sometimes they don't have enough of the right nutrients. I will talk about it specifically, but minerals are real important for your thyroid to function well, especially iodine. And iodine works great for some people, but not others. So we'll talk about how to distinguish that. But you want to fix those kind of problems, and then you'll minimize it returning or having a problem in the first place, right? So the diet is a big factor. Sometimes if people aren't getting enough protein in their diet, then you'll have thyroid problems because you need amino acids to make your hormones. People can have what I call a toxic syndrome, where they have mercury fillings, or wherever they work, they get exposed to a lot of chemicals, in their atmosphere. And these different things can suppress the way your thyroid works. And so some people, if you put them on a detox program and get that out of their bodies, their thyroid starts working better. So that's very important for that detox thing. Things like chlorine in the water can have an effect on thyroid, because it, if you remember your old periodic table days, you got that little chart, and there's these chemicals up there, like bromine, iodine, chlorine. They're all in the same family, right? And so they compete in the body. So if you are getting exposed to chlorine a lot through a shower or drinking water that's not filtered, then you don't absorb iodine in your body as much. And so it can actually alter the way your thyroid functions. And iodine in general is just not real good for your body. So I always recommend, if you don't have a whole house filter, to at least get one of those shower filters you can put on the shower that filter out the chlorine, because it helps the thyroid, but your hair and skin will just feel so much better because it doesn't dry you out as much. But because of the hot water, you can breathe a lot of chlorine fumes, especially if, I don't know if you guys have ever noticed, sometimes they're flushing the lines, and like you flush the toilet and it's like this huge thing of chlorine that you can smell. So that's really bad to take showers in that. So I always recommend a minimum of a shower filter that you replace like every 6 months, and it really minimizes getting that stuff in your body. Stress, I mentioned stress. Whenever there's a lot of cortisol in your blood, then that can lower your thyroid function, because your thyroid is just not meant to be exposed to a lot of cortisol and stress hormones for long periods of time. And some people live in that state. They are stressed out all the time, and they don't. Their organs don't function the way they should. That, good. So those are the main factors: the toxins, getting the right foods in the diet. The other thing I mentioned, that thyroiditis, autoimmune problems, these different viruses, bacteria, parasites, sometimes they affect the body. Candida, if somebody has a yeast problem in their body for many years, that can weaken thyroid function as well. So getting the immune system tuned back up is another reason. Once you get that straightened out, it'll help the thyroid function better. So it's really many different pieces to the puzzle that can cause these different things to go out of balance. And there are the blood tests, a thyroid panel, what they call. But if there's any question, or the blood work is not showing that thyroid panel normally, that's where you ask for the thyroid antibody tests, right? There's 2 tests that they do for that, the thyroid antibodies. And those sometimes will be abnormal, one or both, when the thyroid hormones are normal. So I always tell people, if you haven't had that tested and there's any question, get it tested. And then that just rules that problem out. because if it is, then that usually means someone has a virus or something that's attacking the body. And once you get rid of that, you have a better chance of the thyroid working better. So that can be like really, really important to fix that. Some of the common supplements that work really well for the thyroid once you've handled the toxins and all those other things. Iodine is a double-edged sword, so I prefer like natural sources of it, like there's different seaweed iodine sources that are probably the best because it has not only iodine but the minerals that go along with the seaweed and everything, and so you can get extracts of that is very effective as opposed to like the processed iodine. I'm not as in favor of that as much, but some people are sensitive to the iodine, and you have to go very slow, not give them a lot at one time, because if you give them too much at one time, they get like a detox reaction from the iodine, which looks like they're having a bad reaction, but it's really just a cleansing reaction. So it's always better to err on the low side of taking iodine, not take a lot, and then slowly build up over time, if that's part of your problem. And there's actually blood tests that you can get to measure your iodine levels to see where you fit on the scale. There's glandular extracts. So Armour Thyroid, which is a medication, is a glandular extract. That's what they used to use before they had synthetic hormones, right? They would take the gland from a cow or a pig, and they would dry it and concentrate it, and the hormones from that would help your thyroid work better. So that was like some of the original glandular extracts back then. I mentioned the iodine. Selenium is the other big one. That is very important. If people have the autoimmune thyroiditis, many times if they take selenium for long periods, it'll calm down their antibodies, and they will not be as high. So that can be really effective. And it helps your immune system at the same time. There's an amino acid called tyrosine, and tyrosine is used by the body to help make the thyroid hormones. So sometimes if you don't get enough of that, then that'll also be an issue. And it also helps your adrenal glands work better, so it's like a double bonus on that one, is the tyrosine.
What did you call that right now? What did you name that if you don't get enough of what?
It's called tyrosine.
Tyrosine?
It's Tyrosine. Tyrosine. It's an
a T.
Yeah, it's an amino acid that the body uses as part of the hormone production process. Especially if people are vegetarian, then they don't get a lot of that in their diet typically, because usually you get it from meat of some form. There's an herb called bladderwrack that is kind of a natural source of iodine, but it also has very good properties for the thyroid gland that can be helpful. Another is ashwagandha. Ashwagandha works several ways. It also helps your stress hormones and your adrenal glands work better, but has a really good effect on the thyroid gland. So especially for people that are under stress a lot, that ashwagandha can be very helpful. And you can take it for long periods of time and it's safe. It's one of those what they call adaptogen herbs that you can take for long periods without any issues with it. Fish oils are good for lots of different things, but they can help if there's inflammation in the body. The fish oils help with overall inflammation, but the oils that are in the fish oil can help the thyroid function better too. So that's another good one to use. And then, like I say, getting all the junk out of the body, because that's really important to not have toxins in the body. And actually, I don't think I mentioned the foods. So if somebody is sensitive to a food, like gluten or dairy products, that can create overall inflammation in the body. But for some people, it really weakens the thyroid gland. Because whenever you consume a food your body's sensitive or allergic to, it creates like an alarm reaction in the body. And so the thyroid and adrenal glands are responsible for trying to calm the body down. So if you're constantly eating a food your body's reacting to, it creates this inflammation process. And some people, it'll go to their thyroid gland. And a common one is gluten. There are many, especially Hashimoto's thyroid patients, that are sensitive or allergic to gluten. And when they stop that, they do much better. Their thyroids heal much better. So sometimes something as simple as eliminating a food or a food group will help the thyroid rebound and get back better. That's the one group I forgot to mention were foods. If you find junk food's not good, but I mean, sometimes it's a healthy food, but your body is not healthy for you, right? And so we always try to eliminate those kind of things. And that's where we use the muscle testing. I use a muscle testing system called nutrition response testing, and it helps identify things that don't always show up on the blood work. And it can find weak spots sometimes before they become problematic on your blood work. And we could test food sensitivities, toxins. It's just an inexpensive way to find some of these problems that don't always show up in regular blood work. Or they've had other testing and they didn't find anything, and so they come here and we find the bad stuff and get them on a health program, and then they get better, which is good. So it's really that kind of the overall comprehensive. And then for people that do have the high stress lives, that's where they also need to incorporate the relaxation techniques like deep breathing and Tai Chi, or these different things that help their body calm down. Because if you don't calm down that response, it's really just hard on the thyroid. I've had people that I fixed everything else, but they were stressed out still, and I just couldn't get them that extra mile, because they just couldn't get out of that stress mode that you have to get out of to get completely well. Whether it's family or friends or work, one of those can be a problem. I think I covered everything there. And like I said, there is a time for medication, but we usually just long enough to figure out the problems and then hopefully wean you off the medications over time. It just depends on how long you've been on them. The longer, the harder it is to get off medication. But there's still hope. And sometimes, even though, as I mentioned, the blood work gets better, but they don't feel better. Usually with all of those folks, when you get the junk out of their body and get them eating well, then their blood work looks good, but then they feel better. Because they got those other problems that the thyroid, that the drug couldn't take care of, basically. Because all the drug does is bring up the level in the blood, which is helpful, but if you're eating gluten and you have mercury fillings in your mouth and you're stressed out, it just doesn't work as good, So you balance all those other factors and then it comes back, usually. That's what we found for most people. Does anybody have any questions?
Right now, you aren't finished, are you?
Yeah, I'm finished at this point. That's why I like to open it up, and so we can talk a little more about the different things that
So
people
the
might.
muscle testing you're talking about, is that another word for is kinesiology?
Yes, it's a form of kinesiology. Mm-hmm. Yeah.
I had it years ago.
Yes, yeah, it's just a great way to find out things that can't be found out with blood work and that kind of stuff. Because it's working on an energetic level, it's just different.
Is there anybody behind me that raised?
No, you're good. Go ahead.
When you talk about an overactive thyroid, do you grow out of that eventually?
So it depends. So like I said, whenever I've treated somebody for that, it's always been a virus that caused that overactive thyroid to do that.
What did you do now?
It's always been a virus that's in their body that caused the thyroid to go overactive. And so medically they would put you on a drug that suppresses the thyroid, hoping that over time the body's going to recover.
Okay.
And then they would try to take the drug off, and if it didn't recover, then they're going to say, sorry, we have to take it out. But if you get to the cause, like a virus, or they've got heavy metals in their body, then a lot of times you can calm it down. You can make it go back to normal. But you really have to get it quickly, because it can go out of control, and there's just not enough time to fix it because their heart rate's going crazy. That's the problem with the hyper.
You mean you have explosive heart rates?
Yes, it can go 150, 200, like that. Yeah, and they just feel horrible. I mean, it's like they're coming out of their skin.
It takes your breath.
Yeah. It's not good. But like I said, I've helped several people when they first got it come to me, and we got it back to normal without drugs. So, as like anything else, the sooner you get it, the easier it is to fix it. That's always how it is, typically.
You go down to a local Quest or something and get your blood work done.
Yeah, and the thyroid panel plus those autoimmune, the antibody test, that helps uncover if that autoimmune thyroid problem is there. which is not standard. They won't standardly test that, so you have to ask for that. The thyroid,
What is the autoimmune?
the thyroid antibody test.
Oh,
Yeah, that's the one that tells you if you have something attacking your thyroid gland.
and usually it's, you said, it's a mineral that, is.
Well, it could be many things. But, yes, it could be the metals. It could be a deficiency, a virus, and any of those things can cause that over time. And it does tend to run in families. If you had a mother or father that had it, you're more likely to have it. It doesn't mean you will, but you're more likely. If you,
Is this usually something that you can, like, you see somebody that is on a good diet and exercise, they're healthy,
Mhm.
they have a better chance of not having these problems?
Yes, that's true. Yeah, if someone is, eating clean and isn't stressed out all the time and they exercise and they have less likelihood of getting it. Not doesn't mean they won't, because like I said, sometimes these are triggered by viruses or something like that, and even a healthy person could get that, technically.
And the thyroid does many functions, or?
Yes, it controls all of your metabolism. So it controls the hormones, your weight loss, your heart rate, how well things work in your brain. So that's why it can cause so many problems when it does go bad, so to speak. Or
In your body, you were pointing to your, up here, the thyroid is where in your body?
yes, it's right at the bottom of the throat, at the base of the throat.
There's one.
It's got lobes, so it's on both sides of the neck.
There's
Yeah,
two pieces of it.
correct, basically.
Well, if you take out those two pieces of thyroid, and you continue to have like weight loss or be a hyper person or whatever, why is that? Why does that happen?
Yeah, something else is going on in the body then, if that's happening, right? And if it's just the thyroid that was having problems, then that calms down pretty quickly. But there could still be adrenal gland problems. These other toxins I mentioned that can be in the body, and parasites, all these different things can cause really odd reactions in your body. And so if those aren't gotten rid of, then you'll typically only have so much success with the thyroid removal, because you haven't removed the problem that triggered it, right, in the first place. You removed the thing that makes your heart rate go crazy, but it doesn't always. And then what they do when they take the thyroid out is then you will be on thyroid medication the rest of your life. And if they don't regulate that well enough, then they'll over-medicate you, and then you'll still have heart problems, right? So there's a fine line there where they got to get the right medication, and that can take months to get that right medication.
Can't you grow out of it, kind of?
Grow out of.
Can't you grow out of that extreme heart rate, or maybe you just adjust your life or something? I don't know.
Well, once you get to the cause, then it will fix itself, right? So whether it's the thyroid or your adrenal gland or something else that's causing the heart rate to go up, once you fix that, your body will go back to normal. Yeah.
But once they remove the thyroid, then logically you have to have thyroxine or something to.
Correct, yes. Once they remove the thyroid, you will be on thyroid medication the rest of your life, yes. Because you just won't be producing enough. Yeah.
What kind of medication? Is it like one medication or just one for all?
Usually they just give you what's called T4, the thyroid hormone T4. But that doesn't work for everybody, unfortunately, so it's just not as good. If you can handle like the Armour thyroid, which is the natural stuff, that's better in general, because it's called Armour thyroid, and it has T4, T3. There's a couple other minor hormones that are produced, so there's a little bit of that in there. So it's more like your body would be producing normally.
So do any of the customize that?
No, you have to request it. And unless they're more of a natural functional medical doctor, they won't even recommend that. Most medical doctors don't even like prescribing it. It's like pulling teeth to get them to prescribe it.
Well, would someone who is specifically dealing with the thyroid that is also a medical doctor, would they recommend it?
They can.
I mean, would they think it was a good thing? From what you were saying, it sounded like they didn't think it was a good thing to do.
Yeah, because there's been these questions about, oh, it's hard to get the right dose and all these things,
Yeah.
which aren't really warranted. It's not much different than the other ones, but there is just a resistance in the medical community to use Armour Thyroid for different reasons. But you can request it, and they'll do it, or just find another doctor that will.
Probably out of their expertise, they might not be, know.
Oh no, it's not that difficult to prescribe.
Okay.
It's just there's just this whole bent against it, you know. I don't know. Probably because it's more natural. They don't like that. Is there anything else? All righty, good. Appreciate your time.